Hey guys, so I have had quite a few patients that are so eager and ready to sign up on our hormone therapy, but they have had some hesitations due to some information that they received from either their primary care provider or just hearing it on the street. A lot of it is like, well, no, I don't want a higher risk of breast cancer, or I don't want a higher risk of cardiovascular disease. So I figured we would kind of start with the bare bones of this because it's going to take probably multiple videos to kind of really get into the meat of every issue. Number one is the Women's Health Initiative. So this was the largest study done in history and longest study done on hormones. And this is the one that caused all the craze and fear about hormones causing cancer. So let's break this study down. So when they did this study, they basically did it off of two arms. So one arm was the estrogen arm, where they used conjugated equine estrogen, and then the other arm, which was Premarin, and then the other arm they used a synthetic progestin for the progesterone arm, and that was Prempro. So when they did this study and came out with the findings, they found that the Premarin side, or the estrogen side, actually was breast cancer protective, but it showed the slightest risk of blood clots. And then on this arm, the progesterone arm, which was the synthetic progestin, Prempro, this is the arm where they found everything. They found the higher risk of cancer, the higher risk of stroke, heart attack, all the cardiovascular events, all the bad things. So they took this arm and ran with it. And they came out with, all these articles about how hormones cause cancer and cause, all these awful things. So what they did is they put all the hormones in this nice little neat box and stuffed them in and said, all hormones are bad. So what they didn't tell you was in the study, they absolutely did not use bioidentical hormones. So when we're talking about estradiol, progesterone, and testosterone, they did not use these things to base these findings off of. So, one big fact is that every study to date has shown that there is zero harm in estradiol compared to conjugated equine estrogen, synthetic progestins, or mixing those up together. This estradiol, no harm, every study to date. So hopefully that can kind of ease your mind. Another thing too is with that study, it wasn't a very large range of women. So on average, all these women in the study were greater than 63 years old and greater than 13 years postmenopausal. So it wasn't a very wide range. But we're starting to unravel all of this. It's slow coming, but it is progress little by little. Testosterone used to have a black box warning that said, if you are on testosterone, you will be at an increased risk for heart attack, stroke, cardiovascular risk in general. In February of this year, the FDA actually removed that black box warning, stating that there was not only no evidence to show that any form of testosterone increases cardiovascular risk, but we actually see that it is cardioprotective. So, the right information is coming out. It's just coming out slow. So we're hoping that it just continues on that way. But in the meantime, I'm hoping to educate everyone on this misinformation so that you can get some clarity in the questions and concerns that you're having.